Okay, doctor, what Doppler flow markers are important?
Um, Very important Doppler flow markers for preeclampsia are the uterine artery pulsatility index and S by D ratio, umbilical artery pulsatility index and S by D ratio, and mean middle cerebral artery both pulsatility index, also the S by D ratio. Why are these important is because we want to see whether there is brain sparing effect going on or not. What about the pulsatility index in both these arteries? Whether the arterial supply to the blood, to the the fetus is all right or not. Now, for Doppler flows, this is a complete video that I have made because Doppler flows are very important in fetal growth restriction and for hypertensive disorders in pregnancy. And for that, there is a separate video that I have made. So please go ahead and check out that video. Everything in detail is given over there. To again revise and repeat that same thing again over here is not possible because we've got a lot to discuss right now. So please go ahead and watch those videos of mine. They're available on YouTube free of cost, and they're also included in the respective sections in fetal growth restriction and also in hypertensive disorders. So yeah, these are the three important Doppler markers that I'd like to see, and there are charts available of if according to gestational wise normal flows of all these uterine artery, umbilical artery, and middle cerebral artery, and if there are any absent end diastolic flows or reverse end diastolic flows in any of these arteries, they are ominous markers of the ongoing pregnancy, and pregnancy has to be terminated even with these kind of markings. So very important is the level of these Doppler flows in uterine artery, umbilical artery, and middle cerebral artery. And in that order of first of all, the deficiency will start from the uterine artery, goes on to umbilical artery, and then finally middle cerebral artery will also show compensation in such a way that it'll try to shunt more blood to the brain as far as possible. And then when their hypoxia increases more, placental insufficiency advances even further, then even that will show resistance, and it will show decreased flow even in diastole, so much so that it might become absent in diastolic flow. So that is where you'd have to interrupt the pregnancy.
Okay, doctor. Is there any way to look for or screen for markers for preeclampsia in first and second trimester?
Yes, FMF, that is Fetal Medicine Foundation UK 2016, has come up with, in fact, an entire algorithm in which they call risk assessment of preeclampsia, in which there are certain markers, not only biochemical but also certain markers in the patient's history and examination, which are all plotted together as an algorithm to find out how much this patient is at high risk to develop preeclampsia in this pregnancy. So these markers, they include the maternal, the past history of the patient, the age of the patient, the obstetric history of the patient, the family history of the patient, the mean arterial blood pressure at present in pregnancy, if there was a high risk, antecedent previous pregnancy in whichever ways. It includes the uterine artery Dopplers as well, the pulsatility index of uterine artery, and it includes certain markers, certain biochemical markers, which includes placental growth factor and PAPA in first trimester, and placental growth factor and SFLT1 marker in the second trimester. All these are taken together and then they are plotted in an algorithm and finally given the result. So these are certain markers through which we can know whether this patient is a high risk candidate for development of severe preeclampsia.